Okay. Hello, healthcare humans. Thank you for coming back for another episode of The Other Human in the Room. I am like a little bit too excited about this interview, I will say, because I am a big fan of the person I'm talking to right now and looking at on my screen. Um, yeah, I feel like I should have a preamble for you. Basically, I have the book of
Yeah.
Hillary McBride here. One of multiples, but The Wisdom of Your Body is the one that I really connected with in talking about embodiment. And I know that you, through your work, brings like at least three different lenses to the conversation I have on my podcast, which is, as a psychologist, you have treated healthcare humans like who are burning out and experiencing that. You
Mhm.
are a healthcare human because you provide healthcare to the other humans in your role.
Mhm.
And I know you've written, like, in your book and elsewhere, about your experiences as a patient
Mhm.
and some of the ways you've interacted with healthcare. So that's
Mm.
why I wanted to bring you on and get your
Mm.
perspective on those
Thank
different roles
you.
and just sort of a conversation with you. So I would love if you introduced yourself in whatever way you'd like to the people listening.
Sure. I will do that. But first, what I'll do is I'll say, I am so delighted to be here, not only because I just adore you, but I think what you are doing in the world is so important, is so revolutionary. It feels like, gosh, what is the right way to say it? I don't always think that there is like a trickle down. The best strategy to changing the world is like trickle down, start with the people at the top sort of thing. But
Yeah.
there is something to me that feels so important about rehumanizing the people who have been objectified and then often perpetuate objectification. And I think that medical care often does that because physicians in particular and those who are in healthcare have had to be so disembodied to
Yes.
get through these. I think what would I would probably define as like highly traumatizing educational streams and programs, and kind of the things that are asked of people to become these caregivers require, it costs them so much. So anyway, I just see that in so many different ways, and I think that what you are doing is revolutionary and important, and feel so honored to be here with you.
Thank you. I'm
You're
just taking
welcome.
that in. That feels
Yes,
very nice to
yes.
hear.
Good, good. Yeah, you put that, that's for you. You put that in your back pocket when you need
I
that.
am.
You pull
Thank
it back out
you.
whenever you need. So I'm officially, I guess you could say, I'm Dr. Hillary McBride. I'm a registered psychologist, blah, blah, blah. I most identify as a person who is curious, as a person who cares about other people, and as a mother. And I imagine that how I identify often adapts based on the context I'm in and what is alive for me. But the reason I situate that kind of at the forefront of our conversation is because I think it's really easy to lead in this conversation with again, these kind of like reductive or two-dimensional roles or the expectation around my professionalism and credentials in a way that, minimizes my humanness. So, in the same spirit of what you're trying to do, whenever I work with patients or I start a relationship, a therapeutic relationship, I often start by saying, can I tell you about my journey as a patient? Can I tell you about what it's like for me to have been in therapy and how that's changed the way that I work? Because it is so important to me to dissolve the power hierarchy where someone is the fixer and someone is the broken person and they're the patient, and or I'm the doctor and I have all the answers. And actually, I think that the way that we really actually heal is when we're human together, when we're in relationship together, when we connect. So what that means is I have to be comfortable with my humanness, and I have to be comfortable with the person underneath the role, and not use the role as a shield
Mhm.
or as a crown, or any other archetype of or symbology for power or armor. And that's part of why it feels important for me to say, I'm a person who loves questions, and I'm a person who loves people, and I right now am a mom, and I am momming so freaking hard that
Love it.
feels like the predominant way that I identify in the world right now.
So good. Yeah. How old's your daughter?
She is 19 and a half months. And it is so funny to measure in like months and half of months. But I felt every single one of those months and every single one of those days. I'm like, I was awake for all of them.
You
I
counted
earned
them.
those. I
Yes,
counted them.
for real. And
Yes.
they like literally become a different human
Oh,
themselves. They just are like
exactly.
budding and blooming into a
That's it.
person.
That's it.
Yeah,
Exactly.
I
Mhm.
love that. Oh, I love that introduction.
Thank you.
So I thought one of the really important concepts that I learned from you and some others, but from your book in particular, was this idea of embodiment. And is it too much to ask to get kind of a definition or how you like to describe embodiment to other people? Because
Mm.
I think it's not something I had necessarily even heard of before.
Hmm.
Though obviously it's got like like ancestral, like it's been around all of life, but we don't
Yeah.
in our culture necessarily talk about it so much. So
Yes. Yes.
please.
I would love to do that. And I think that the politics of why we talk about it is important too. And you kind of identified that there. Like
Yeah.
the reason we have to have a term for embodiment
Yeah.
is because we've experienced disembodiment
Mm,
predominantly. That's been our way of orienting to the world, often in, Western context and white supremacist context, in androcentric context, in highly cerebral, kind of dissociative
yes.
landscapes. We have needed to figure out what has been missing. What have all of these ways of conferring power and distributing power, what does that cost us? And really it's connection to our bodies and to each other and to the land and all of that. So embodiment comes because of disembodiment. But as you alluded to, embodiment has always been our mother tongue. It is the foundation of being human,
Yeah.
and it is the felt sense and the quality of the aliveness that is in our sensory, temporal, bodily, corporeal selves. So the definition that I like to use has to do with two things. One, felt experience,
Mhm.
and the other one is social context. So it's the experience of being a body as that is shaped and shapes the world around us. There's a dialectic, my matter, my felt experience, just even to drill it down, like why I can listen to the feelings I have, why I notice my hunger cues and pay attention to them and honor them,
Yeah.
is to do with the social context I've been in, what's been rewarded, what's been praised, what's been valued, what I've told I need to be, the constraints and the corsets that have been placed on my self-expression, how I've been rewarded for that, et cetera, et cetera. So always those two things, always felt lived experience of being a body. And there's a valence to that. That could include, right, really it feeling unsafe to be in a body, all the way to I love and feel empowered and attuned to my body. And I know how to notice my cues and care for them, as all of that is shaped by sociopolitical context and discourse around bodies.
Yeah. Like a way that I found accessible to talk about is like especially that sociopolitical is sort of um what you've been conditioned to believe
Mm-hmm.
about the world and about yourself, and that
Mm-hmm.
I like the word conditioning because it's not just like a thought I've been trained to believe in my brain, but it's an experience I've been trained
Yeah.
to experience in my body. Like if
Yeah.
as a clinician, if I'm afraid of making a mistake,
Uh-huh.
it's not just like, oh no, I am worried in my brain and I have my ticker tape of worries, but also like
Mm-hmm.
it's a full body experience.
Mm-hmm.
I hear from colleagues and clients like, um, and that I don't know, to me that disconnects with what you just said about that.
Yes.
Does that resonate with
Yeah.
you?
Absolutely. Yeah, the
Yeah.
conditioning, and I think of conditioning like when we actually look at what it is, both classical and operant conditioning in terms of like the school of behaviorism,
Yeah.
there is time after time after time after time
Yes.
when those messages are instilled inside of you to the point that they are unconscious. They live in your tissues, they live in your nervous system responses, and your nervous system is constantly making associations between things
Mm.
that have nothing to do with your conscious awareness or your thinking self. And again, this kind of disrupts our perception of ourselves as being highly rational and organized and linear in our thinking. And of course, the research on that was debunked decades ago, and we could see that people instinctually were making choices and
Mm.
seeing motor nerves firing before the parts of their brain that are responsible for rational thought were ever engaged and had, something happening to them neurologically, that our bodies are making choices before our thoughts are almost all the time.
Mm-hmm.
And then we're just coming up with really fancy stories to justify why we went the way that we went. And it, yeah, I think it's a little scary sometimes to realize just how much is going on, both in our conditioning, in our felt sense, in our non-conscious automatic processing, bottom up, body based. And it's a scary thing to think about. So we're like, well, we do this little dance and we tell the story. We're like, we're really rational and it's all cerebral. And that's the most important part of us. And let's figure it out. And I think it's kind of scary and beautiful and mysterious to remember that there is a whole other dimension to our beingness.
Yeah, that's scary is a good word. Like, I think
Mhm.
it's valid, especially I remember you saying to me, I noticed that when I work with folks in healthcare, they're often neck up.
Mhm.
And I think that's so good because I really, both through listening to you and other people, I realized I used to think of myself as a cloud of thoughts with a body attached. Not
Uh-huh.
like I wasn't writing in my diary, like your diary, I am a body, like, but when I thought of like if I like pictured myself or if it just was like how I sensed myself was up
Yeah, that's
here
right.
and thinking all the things and doing all the
Oh,
thoughts and which argument's right and who's thinking about me. And it was just like constant like words in a
yes.
cloud. And then
Yes.
once in a while I'd stub a toe and be like, oh,
Oh, I have a toe. I have a foot. There it is.
there's something attached to me. And I used to think it was, again, not consciously, but if someone like pop quiz, how do you think this brain body thing works? I'd be
Uh-huh.
like,
Uh-huh.
your body's responsible for keeping your brain alive because your brain
Mhm.
is what's treasured and prized.
Mhm.
And I don't think I'm alone. Again, no one
Mm-mm.
necessarily talks this way to each other, like in the lounge at the hospital, but the way that we speak to each other hints at that we think we are just these brains bouncing off each other,
Yes. Yes. Well, can I
right?
interject
Please.
there in a second there?
Yeah.
Because I think you're saying we don't really talk to each other explicitly that way, but actually the foundation of our language
Mm,
is to objectify the body, because we say, I have a body. Who is the I that is in possession of the thing that is the body, right?
yes.
Even the way that we use our language to say, oh, there's a toe is attached, or even what I said, like, oh, I have a toe. Who
Yeah.
is the I, right? And often what we mean by that when we say it is our thinking self is seen predominantly as the seat of our self, as a seat of our identity, and everything else belongs to, is possessed by, is in service of this thinking self. So the language, I think, reinforces that in an unconscious way,
Yes,
even if it's not
absolutely.
explicit.
Right. And it's when that is the language, that's the default. So then if you're like, I am my toe, people are like, okay, it's
Right.
that seems odd,
Yeah.
but how is that less true in a way?
Yes, I
Right.
know. Well, Merleau-Ponty, in his really important work in reintegrating embodiment back into Western philosophy and inviting us to look at how bodies are the location of the self.
Hmm.
He looked at this duality, the constant tension between subject and object, and how we are both. We are making ourselves both. We are being made into both, and there is a dialectic again between being a subject and object, because I do also have fingers,
Yeah.
but I also am my fingers, and our
Yeah.
language is limited in that it kind of like there's so much subtext to that, but they're both true.
Mm,
Like the fingers belong to my personhood. You could look at my hands and go, those are Hillary's,
yeah.
right? The collection of experiences and autobiographical narrative and lived experience and nervous system response and all of that is Hillary. And somehow it belongs to that collection, these parts of me.
Yeah.
But we don't think about it that way necessarily. And so we just get this kind of reduced down, like, oh, my body won't do what I want it to story that kind of pathologizes us and fragments us and so on.
Yeah. So I think thinking of us neck up folks in
Mm-hmm.
healthcare, not to a person, of course, but as a theme, what do you wish more clinicians knew about their own bodies or thought about their own bodies, just because they're humans, but also in
Mm-hmm.
service of their work, taking care of other humans?
Yeah. Oh, I think that there's something in this that I'm having a reaction to, and that's that I can imagine how impossible it would be,
Mm.
at least not impossible, how far away we are from this feeling true. But what I want people to know is that it actually makes your work better when you listen to yourself.
Yes.
It actually helps you do better work. Your attunement to your patients, your ability to trust your choices, your ability to tolerate the consequences of not making the right choices, the ability to really listen with layers to what is said and what is not said, and to know when you've had too much so that you don't push yourself beyond that and then experience the consequences of that. Like I think, and maybe what I'll add one more thing to that is too, like modeling
Yes.
for your patients how to be whole and human and listen to yourself is a way to teach them how to listen to themselves. But I think we are quite a ways from that. And so I can hear already in my own head the pushback from even patients of mine and people I've been in conversation with, which is like, okay, but I can't actually exist in this system. The system won't allow me
Mm.
to listen to myself in that particular way. So I just want to hold that we might be a little ways from that. Or perhaps if more people believed this, we could build a system that was different.
That's what I'm
I know you're
working
doing it.
about. I think that is the only way, is to embody the system you want to someday.
Yeah.
The system's a bunch of humans. Someone's
Yes,
got to start.
exactly. That's right. Yes. Yes.
Okay, I'm
That's right.
curious about that then. So say you're working with
Mm,
a patient in healthcare and they are struggling with that. How do you begin? Of course, it'll be different
mm.
for each person, but even like practical ways to begin to feel a bit more
Uh-huh.
embodied in your
Yes.
work. How
Yes.
would you
Okay.
start?
So I think actually that's the only way, is like the small
Yeah.
practical things. And I think what that does is it builds a sense of trust
Mm,
and attunement that then allows us to risk with some of the bigger things. Like if
mm,
we know that it can be okay to touch in on this little bit of information and respond to it in a certain way and see the impact of that,
mhm,
right? The bigger things follow. So, really simply, I think noticing, like, when was the last time I got up and moved? Right? Is this a comfortable way of sitting? Is there a better way of sitting?
right.
Is there something inside of me that says I want to adjust my posture? And there may be, but do I listen and do I adapt? Right? So there are little things like that. I think, do I have snacks nearby so that when I'm hungry, I can feed myself? Do I have water on my desk? So when I'm thirsty, I actually can meet my need immediately and go, oh, thirst, like, thank you. I'm listening to you. Thank you.
Yeah.
I'm paying attention and honoring that. And then I think simply things like, can I check in with myself at the beginning of
Mhm,
the day? Can I remember that I'm a body and exist? Do I need to put a post-it on my desktop to remind myself to ask the question, like, what do I feel in my body right now?
yeah.
What's going on? And I think to include in that emotional experiences, to include in that the need to notice the subtle signs of stress, right? When we start to
Mm,
listen to ourselves and we start to ask the question, like, what's happening for me? What am I feeling? And we continue to ask those questions, even if we don't get a lot of information right away, what we start to notice over time is the subtle differences. So maybe I'm not really noticing much, but because I keep asking, I have a really difficult encounter with someone. And I notice, whoa, my back is a little bit more sore after.
mm,
Okay, that's one data point. I'm not sure what I'm going to do with that. Interesting. Okay. And then I notice every time I work with that person, my back is sore.
mm,
That's interesting. That's telling me something. Okay. But then I notice every time I get up and I go for a walk and I shake it out, my back doesn't hurt anymore. So
yeah.
then I start noticing, maybe I shake it out before that person comes in. And maybe instead of waiting till the end of my day to go for a walk or to feed myself, I do it immediately after that interaction or before. And all of a sudden, I'm paying attention to what that information is saying to me and what I need to do about it. And I'm caring for myself. But I think it
Mm,
starts by asking the question, what's happening for me, and
yeah.
creating little opportunities to respond to our bodily needs, just in very, very simple ways.
I love what's happening for me. It's not, it is a simple question that then whatever is answered is a good beginning, you know,
Yeah,
because
exactly.
I think well, love a all or nothing perfectionists need to now be A plus in embodiment or whatever. So it's like,
Uh-huh.
well, how many bubble baths? Or I don't know what people
Yeah,
think.
yeah,
Like you got
yeah,
to be a
yeah.
yoga master or something. But it's like, no, it's actually like
Uh-huh.
listening to yourself a little bit.
Yes, exactly.
Yeah.
Like I love disrupting that paradigm by saying, yes, maybe you're like writhing nude on a beach under a waterfall somewhere, like having this erotic embodied experience of self-expression. Like,
Yeah.
okay, cool. But also maybe you had to go pee and then you went,
Yeah.
right? Like I think
Mhm.
I think in terms of what embodiment is, there is this whole continuum, and the things that really define it have to do with attuned self-care,
Mhm.
right? Like that is one of the cornerstones in the empirical literature of what a positive experience of embodiment is. It's I am paying attention and
Yeah.
honoring the information my body gives me. Yes, do I want to have like creative self-expression? Do I want to be able to advocate for myself around my sexual desires and needs? Do I want to um experience pleasure and joyful movement? Do I want to have agency and autonomy and power? And like, of course, all of those things are great, but it starts by like, what am I noticing and can I respond to that?
Yeah. I think it's a way of also practicing answering the question of what I want, which I
Mhm.
personally thought I was like, I don't know what I want, which wasn't factually true in that I often still did things I wanted. But
Mhm.
I think me and potentially more socialized with female or whatever, but like I noticed that as a theme in people I'm working with now, where we're getting past some of the inhuman stories that are called like the deconditioning of say like
Mhm.
perfectionism or caring more about what other people want than you, da da da. But then they're
Mhm.
like, but I don't know what I want. I don't know even who I am outside of that. This is a very
Mhm.
practical way of beginning, right?
Yes. Well, could we dive into affect theory for a little bit? Would that be
Yes,
okay?
please. I'm
Yes.
very
Okay.
curious.
So, emotion is a really important part of embodiment.
Mm,
And many people might be surprised by that because we again think of emotion as being the name that we give to the feeling instead of the felt sense and the quality of it. So, like anger is going to make your jaw a little tight and your throat a little tense and your hands hot.
yeah.
Fear is going to make your legs a little activated, maybe your hands cold. Like there is a physiological signature to every emotion.
Yeah.
What many people don't know is that we're born with a series of emotions, and regardless of globalization, socialization, gender, family history, you're actually born having a few key affects
Mm,
that come with mobilization tendency. They come with energy, they come with directionality, they come with self expression, and they're meant to help you survive, connect, flourish. Wanting, or in another word, desire, is a core affect. You're actually born. We're all born knowing how to do it,
mm,
which then makes us ask a really interesting question. How do we become, 30 something and, really successful and have no idea what we want or
yeah.
feel disconnected from the sense inside? And I mean, you won't be surprised to hear me say this, just given my discipline. We have early experiences with our care providers where it costs us connection
Yeah.
to stay connected to our wanting. We want, we know, we're clear about it, we communicate it, and we get shamed, we get sent away, we
Mm,
get dismissed, we get judged. Our caregiver is overwhelmed.
yeah.
And so, what do we do as a species that's wired to survive based on our proximity to those who can care for us? We're going to forfeit that thing that we know and even what it feels like to know that we know
Yeah.
so that we can be safe. And then we end up, like I said, here in our adult lives asking, what do I want? I don't know, without having any idea that it was born into us, but also we had to kind of disconnect from it just to survive. And there's a whole feeling that usually comes along with that. And we call it grief, and we call it anger, and we call it fear. But my invitation is to remember, kind of like with every other facet of embodiment, we were born knowing how, which
Mm,
means all we have to do is remember. We don't have to learn from the ground up. We don't have to build a whole new system. And I think what kind of where we're getting in the conversation here is to pay attention to those little cues. Like maybe we go to a restaurant and we're looking at the menu and we definitely know we do not want to eat that thing. That does not appeal to us. And even that is information. Like that is good information about what our not wanting is like, which then tells us like, okay, maybe my wanting is taking me in the direction of this thing on the menu. And paying attention to those cues and having experiments around them can remind us like, oh, there's like a subtle draw forward. Or maybe, you know, I feel this kind of like bubbling in my stomach, or my wanting physically turns my body in a direction towards the thing that is appealing to me. My feet point. You know, I'm sure we've all been at a party, maybe not since COVID, but you know, a party where someone is talking to us and they have our attention and we're trying to get away.
Yep.
And our feet are pointed in the opposite direction. But like, so our feet are like, I want to go, but my face is looking still at them saying like, I'm trying to please you because I don't want to be rude. And there's this conflict, but you can literally see with your feet, like you want to get away. And it's right there in our bodies. And it has been the whole time.
Oh, that's so good. I also think like talking about affect, that's one thing that there's a chapter in your book about emotions and this idea of emotions all being there to take care of us, all emotions being physical. And I think another powerful thing learning about this way of speaking about what's just true about our bodies is it really has shifted how I approach patients coming to me. Well, first of all, with emotions, which is 100% of them because they're humans, but like, you know, especially emotions they're struggling with, mental health appointments in this way that we label them. And it's really interesting what we're taught in medical school versus what you just described about emotions, which is in medical school being taught like, here's sort of the list of symptoms. Some of them which are like guilt is just on there as like one of the diagnostic criteria for depression. It's like, so
chronic and relenting guilt.
These things. And if you have these things, this means you have this thing by depression. And then which medicine should we put you on / refer you for CBT, which is like, I now teach the mental health component of family medicine. And I'm frequently like, how do we expand what we teach? Because I'm like, this is what is truer. And even like we have this term like somatization, which it's its own little box in a corner. And we're like, maybe this person's symptoms are somatization. As if not all symptoms we experienced are experienced by our soma, which is another word for body, I think.
Yes, exactly.
That's a big observation. And it's also like literally describing your entire field of expertise. Maybe it's too big of a question, but like, why do you wish that physicians, and I know lots of different kinds of physicians, but like kind of the classical ways you maybe witness that physicians speak about emotion and mental health and how it would make our jobs easier if we maybe shifted how we understood emotions? Very leading question. Do you know what I mean?
I love it. I love it so much. I have this fantasy that people will go into their doctors with symptoms. And their doctors would say, what is your symptom saying?
Yes.
Right? What information is your knee, your sore knee, giving us about what it's been like to be you? Or that chronic back pain, if it had words, what would it be saying about your life? Right? Like actually going, great. Of course, everything is somatization, right? Because we're actually supposed to be feeling everything in our body. The irony being that many times in our culture, when we've been told our body doesn't exist, shouldn't exist, should be subdued, should be controlled, when we're not listening to this more subtle signs that things aren't working, that we're scared, that we're overwhelmed, that we have unprocessed trauma, that we're unhappy, that we feel devalued, that we, in an unsatisfying marriage, whatever the thing is, like we dismiss those subtle signs, and then our body's like, oh, you weren't listening? Okay, guess what? I'm going to turn it up, and now it's going to be impossible for you to ignore this. Like it's really interesting looking at the way that our bodies are constantly communicating and what would happen if we didn't pathologize that, but if we respected it. Like, I was working with
Yes.
someone the other day who was saying, I had this horrible back pain at the Christmas event that I didn't want to be at.
Yeah.
And I was like, yeah, so what did you get to do? You get to go lay down in your room the whole time. How wonderful that your back was taking care of you. It was literally ejecting you out of that experience you didn't want to be in. Like, let's not pathologize the back. That's like, oh my gosh, that's brilliant. Your nervous system knew how to get you what you needed when you didn't know how to ask for it.
Yes.
So like how do we listen? How do we negotiate with pain? Like, I just think that it starts by, again, this modeling of people in care or people who are doing the caring saying, I believe you. And I believe you actually maybe even more than you believe you. I believe that your body is saying something so important that you don't even know it's saying, but I want to know. And would
Yes.
you tell me? Could you listen? Could you start listening every day? Go sit outside in your yard and ask your back what it's saying to you.
Mm.
And wait till you hear something and come back in a week and tell me what you found and we'll go from there. Like, can you imagine what that would do in healthcare?
It would be so fun. I have started asking
I
it
believe
more.
you. Yeah.
But I want to do it even more now.
Really?
I
Oh
because
my.
like I one block I have is that so this is like I picture it. So here's like my brain and here's the patient's brain, and we've both been disembodied. And then between us, we both have bodies, but between us, we are examining this patient's
Mhm.
body and what it's trying to tell us. And so sometimes I try as much as possible to drop down and listen to and speak to the body, if you will, and in
Mhm.
how I'm asking
Oh,
questions and like the
oh,
hints
I
I'm
love
getting.
that.
And then sometimes then the patient joins me, but sometimes they're like, no, but I need an MRI for my back,
Mhm.
and not, of course they think that. Look at society.
Mhm. Yes.
Um, but that's like kind of one approach. And I literally think about it up here, down here.
Oh, oh,
But I think
yeah.
even just more saying out loud, I say a lot like emotions are signals. They're trying to tell you
Yes.
something. Pain, that's another
Yes.
thing from your book. And then pain is another signal. It's trying to tell you something. Sometimes it means there's tissue damage, but sometimes it means nothing. I mean, not nothing, but sometimes it means it's the signal, not the damage that's there,
Mhm.
right?
Exactly. Yeah.
Um, and the more I understand that for myself, literally, physically, the easier it is to experiment with ways to explain it to patients, you
Uh-huh.
know,
Oh, yeah. Yeah.
because the language is not the default
Mhm.
most of the time. I am curious. I would
Mhm.
just love to hear more of your language. Like both, I mean, emotions and pain, I mean, they're all in the same signal bucket as a
Mhm.
one way I think of it in
Mhm.
terms of
I
what
think
they're
so.
doing with
Yeah,
hunger and things.
communication.
Yeah.
Uh-huh.
And so when you are trying to do this translation of like what you know and offering that to your patients,
Mhm.
what are some ways you've found helpful to allow them to connect? Because we're used to thinking about, well, emotions as a problem and pain definitely as a problem that is
Mhm.
absolutely dangerous and means something's wrong. Actually, is
Mhm.
that true about all of the things I just named? Maybe that's one of the messages. Like, I can't be angry, or it's bad to be sad.
Yeah.
It's
Yeah.
bad to have pain. What lang what ways do you explain to your patients that you have found helpful to gain get a bit more of that insight for themselves?
Yes, yes. Um, so Dr. Ron Siegel's work has been helpful for me in this, particularly as it relates to the more kind of the discomfort experiences of being in a body and how much we resist those. And
Yeah.
he uses this principle that I think comes from Buddhist teaching, which is about two arrows. So the idea is life
Mm.
shoots the first arrow. Right? Something happens, like you mentioned, you stub your toe, or you all of a sudden you have back pain that you're surprised about. But then you have a second arrow. And we, with how we're trained to respond to our bodies, pick that arrow up and shoot it right at ourselves.
Yeah.
Being able to recognize that we are participating in our own cycle of distress and then like being curious about that, slowing that down, pausing that, perhaps even setting it down,
Mm.
to bring some more nurturance and care to the place of the injury, to the first arrow, right? That's a path that I think takes a lot of time to develop.
Yeah.
But it serves us in so many different ways. Like, oh gosh, I'm just thinking about illness and injury to relational distress and, emotional suffering and just the things that happen in life that we can't control. And so simply being able to say, so I should say shouldn't say simply, being able to say to ourselves, I'm not going to add to this distress. I'm going to just notice what is there. And I'm really going to try to set down the story that I'm telling myself about it so that I can investigate it. Like even just take physical pain, right? Pain often comes with a fear, avoidance, anger, blame kind of second arrow cluster. So it's very normal for us to experience pain in any way, emotional, physical, which are not that different. And then get tight, avoid, kind of spin, get anxious. And what happens if we actually feel the pain? Like if you could imagine and visualize the pain as like a circle that had an exteriority to it, right? Maybe you notice that your back is in pain, but your fingers are not. So somewhere between your back and your fingers, the pain has dissolved a little bit. So let's just feel the edges of the pain and let's imagine we could draw a circle around it. What would actually happen if we went right into the heart of it and felt it? Like I saw you lean back a little bit as you did that. It's like, it's so interesting, right? Like we're so scared of doing that, but what is in there?
Yes.
Sensation. That's it. That's literally the only thing that's in there. If we take all of the extra, the second, third, fourth, fifth, 12th, infinite arrows out and we pull them out of that, it's sensation. And what is a sensation like? We're too afraid to look, but what it actually is, pressure, heat, tingling, maybe like a pulsing sensation. Would it be like a stabbing? There are all of these different words that we use to give to pain. But if we were to try to extract the fear quality of it, like what is actually in there? And it's so interesting. The closer we get to what pain actually is in any of its forms, without the second, third, fourth, fifth arrows, we actually realize we can tolerate it. We actually realize, right? Like we can be with it. It's all of this extra stuff around it that goes into like, I'm afraid and it's going to go on forever. And then I'm not going to live the life I want to live. And I'm scared and who knows going to love me. And I can't do this. And I'm unfulfilled. And then I can't be who my parents expected me to be, blah, 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 right? All of that. Like that's the really, really hard to deal with stuff in a way, or like kind of the complicated stuff. But what's actually there? It's sensation.
Yeah.
And sensation, like generally is survivable.
It was designed to be survivable because it's part of our system.
There
it would be a bad system.
Yes. Yes.
I say that about emotions a lot, but of course, pain being, well, anyway, I feel like it is somewhat a contributor. I don't know if and anatomically it is, but again, it's an undesired feeling in our body. And what I say about emotions is like they're from you, they're there to protect you, they're not there to kill you.
No, exactly.
Exactly.
And I think it's interesting because I think that, the literature on chronic pain and the treatment and interventions that we need to use around it are actually not avoid it. It'll heal. It is be with it, be in relationship with it, go towards it, learn to love it, speak kindly to it. Like before anyone is like, I'm going to write you an angry letter because you don't understand what this is like. I've lived with chronic pain. I've had chronic pain for 13 years based on a series of very severe and traumatic car accidents. And so I have since learned that that's a very useful place for my body to put my emotion when it's unprocessed as well. So I understand the relationship between my pain and my unprocessed trauma that existed even before the accidents. Yeah. But what I'll say to you is that we now know that one of the best interventions for chronic pain is to learn how to be with it and bring it with you, right? To feel it and be like, okay, So let's go live our lives, and pain, you can come along,
Yes.
right? Come with me as I go dance. Come with me as I go do those things that are meaningful. Because as soon as we use the avoidance of our pain to avoid all other parts of life, then the pain actually gets bigger. There are more arrows, et cetera, et cetera. So I just think that there's something really genius about going towards it and seeing, exactly like you said, it's information. And that
Yeah.
is information that can keep talking to me as I'm playing tennis, and can keep talking to me as I'm, you know, making dinner. It's allowed to keep talking, and I'm going to keep living.
Yes.
Mm-hmm.
This is okay. I have to tell this in an anonymous, like I literally was talking to a patient who has a very
Okay.
specific pain symptom that is
Okay.
causing them distress. And they came in and they're like, I'm suffering so much with
Mm-hmm.
this symptom. And the workup has
Totally.
been done. The workup has been very done.
Okay. Yeah.
And then, especially when you hear the whole story, they are able to do specific things that if there was something, if an organ was failing, they wouldn't be able to do that thing without the symptom getting worse.
Right.
Maybe, and so it's like we've got good information about there not being, a leak or a tumor or a something somewhere in there.
Mm-hmm.
And then they're describing how much they're suffering with it. And then so getting curious about what they mean by that specifically. And one
Mm-hmm.
feature is that they avoid doing, they don't go out very much. Like they do this one thing, but they don't go out very much. And so like
Mm-hmm.
literally my invitation for the treatment plan was like, go out with the pain. So it's like so neat to
Yes.
hear, like,
Yes. Oh,
see what happens with it.
yes.
Will it make it bigger or smaller? You have experienced
Uh-huh.
it at this point tons of times because we still have not sorted another way for it to disappear
Uh-huh.
from your life. And so
Right.
what happens if you take it along with you, And
Mm-hmm.
so we'll
Ew.
see what happens when they come
That's
back.
right.
Like,
And this,
oh, so
this
exciting.
reminds me of the existentials around Merleau-Ponty's work was really useful in saying we are corporeal, we
Mm,
are temporal, we are
mm,
relational, we exist in contexts and environments. So our body is not in its fullest expression in one given moment of time. We have an arc.
yes.
And so take your pain out for a walk, but also see what happens when you do it 10, 20, 30
Yes.
times. What's the plural of the data as you do it more and more and more, and see?
Yeah.
Because I could probably guarantee that one walk,
No.
no, it's not going to be sufficient to live your life and bring it along with you, right? There has to be a sense of like, oh, I can do this and I can keep going, and it can come, and I can start to notice other things besides my pain as I'm on this walk. But that doesn't happen the first time. It happens, as we keep doing it.
Yeah. My last line of questioning I was thinking of is your experiences as a patient in the healthcare
Uh-huh.
system? And I didn't say, but you're Canadian like me.
I
So
am.
over in
Yes.
BC and I'm in Ontario.
Mm-hmm.
Um, and what were some experience, and only of course what you wish to
Mm-hmm.
share and feel safe to share, but like experiences that you felt helped you
Mm.
with in an embodied way in the healthcare system. And then also experiences where you went, ooh, this is an area where clearly um, the practitioners or the environment isn't set up to consider that they're treating
Mm-hmm.
bodies. And maybe there's way more examples into one
Sure.
category than the
Sure.
other, but I just think, stories are so useful. And
Yes.
what do you
Yes.
think
Yes.
about that?
Okay. Well, as a trauma specialist, I can tell you that most physicians that I've worked with don't understand the neurophysiology of trauma. They don't understand how trauma is connected to the way we manage stress and hold pain. And I'm just even thinking of the research around the ACEs study and what it does, what early childhood trauma does to our bodies as we age, and how important it is to actually keep redirecting people towards working on the trauma and healing it. So, in my experiences of trauma, um, yeah, I haven't felt accompanied, and like even it's kind of tricky, right? Because this is my field of expertise. And so sometimes I'm like, I want to talk to you about what's happening with this particular nervous system response. And they're like, I don't get it. And I'm like, but you're my doctor. You're supposed to know more than me about this. Meanwhile, like I'm the expert in the room educating them.
Yeah.
Like, you should see the
That's tricky.
findings from so-and-so's 2012 study, because this is really going to change the way you practice. So I think it is tricky, but I would love to see more understanding of trauma. I'd love to see more understanding of how the body is connected to mental health. If we don't understand the way that the body is connected to mental health, we're going to be missing all of these pathways towards intervention.
Yeah.
And often physicians are people's like first line of contact when they have a mental health issue. And so physicians being able to recommend different kinds of therapy. I mean, in my years of having disordered eating and in and out of various forms of treatment, was given more ways to think about how to perform being a body that was pleasing to other people, and not given very many ways to remember how to listen to myself. I can tell you everything that was on the food guide. I can tell you everything about goal weights, everything about the symptoms of my eating disorder, and how to perform what recovery looked like. But I didn't have very many people tell me you can trust yourself, because I kept being told you can't trust what your mind is doing. You can't trust what your body is doing, et cetera, et cetera. So trauma, embodiment, blah, 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 this whole conversation. What I will say is that I had 2 experiences within the last 2 years that showed me healthcare at its best. And one of them was a home birth that I had, an unmedicated home birth that I had with midwife and doula. And I mean, that's not right for everybody, but it reminded me about that unique experience of pregnancy and childbearing that is non-pathology focused, and what it's like to like come alongside someone in a normal developmental transition and support their body to be well and help them trust themselves. That to me feels like, in a way, healthcare at its best. But we don't often go to our doctors because we're doing great and we're like having a normal experience. We go for, for something that feels out of the ordinary. And then the second experience was getting an IUD, where I was, I think, 8 weeks postpartum, and I had the physician who was not my family doctor, but had been recommended to me because she was, she does this a lot and is really, really gifted at it. And she said, take a moment before I put the IUD in and touch your body and just say, right, if you do really want this, say, I want this, and we're safe.
Oh, that's great.
Yeah, like have a conversation with yourself about consent, because it's going to change how the tissues experience what's about to happen, right? If you actually know this is safe. And then after, she said, okay, like you can pull your knees up to your chest and just rock a little bit. There's a bunch of different kinds of movements that really will help this not feel so intense right now. And so let's use a little bit of movement and keep saying to yourself, like, thank you. I want this. This is okay. I'm safe. I was like, did she read my book? Where did she learn this?
Maybe.
Who taught her this? I was like, this is incredible.
I'm like, give me her name after this. I want to learn from her. That's genius. I do IUD insertions and I'm like, I've been more, I do a lot of checking nonverbal cues, but we've got to make it verbal. I want to start saying that. I think that's wonderful.
Yes.
That's
like
so
this,
good.
my orientation in therapy, or kind of one of my frequently used theoretical frameworks, is something called AEDP, Accelerated Experiential Dynamic Psychotherapy. And in AEDP, one of the cornerstones is make the implicit explicit. Whatever you're thinking, just say it, right? Like, I'm worried about you. I'm noticing that you took a breath. How about you say to your body the thing that we're both thinking, right? Actually say it to yourself, right? Like make it explicit as a way of like deepening that experience and being with what's actually happening in the room.
So good. Okay, we have 5 minutes left, so I'm gonna wrap it up because I could just talk to you forever.
I could talk to you forever too.
Okay, so yeah, I guess any final words. So like healthcare, I don't know, is healthcare better or worse than it's ever been? There are objective ways it's falling apart. And that's my story. And to me, that's very sad, and also can mean opportunity, because it means that whoever was trying to control it is doing a bad job. So maybe we can sneak in and change some things, So for those listening who my presumption to those who listen is they do want to keep working in healthcare. There's something about it they love, but they want to feel more
Mm.
human in it. They want to actually enjoy their day. They want to actually feel like they have agency and choice, which they do, and then they feel like they don't. There's like what would you want to say to them? What encouragement or
Mm.
words do you want to offer them as they continue to figure out their version of human feeling healthcare?
Yes, I think curiosity goes a long way.
Yeah.
Being able to remind ourselves that there's something inside that helps us know that we can be open to learning, that we don't have to know it all, that we can figure it out. And I think that we're always going to do everything that we do better if we come at it from a position of, I wonder what could happen if, as opposed to like, it has to go this way, or I have to be right, or here are the stakes. But freeing ourselves to be in a position of not knowing and being interested in knowing, and interestingly experiencing what could happen if let's find out, right? That takes us somewhere in itself already.
And that's, it doesn't feel familiar to us, but that's like, scientific method. Like
That's
this is
right.
being that like curious scientist of your own life. Like
Yes,
you don't have to
exactly.
know. How could we know
Yeah,
everything that we
that's
need?
right.
We
Yeah,
gotta figure it
that's
out.
right. You said it.
Thank you so much. I really appreciate it.
This is
Do you want
wonderful.
to share where
Mm.
people can find you and learn more
Oh,
about
yeah.
what you do?
You can find me on the internet at HillaryLMcBride.com. And then on social media, I've got Twitter and Instagram. I can never remember what my handles are. So maybe you can link them in the show notes if you have them.
Yeah,
One
for
is
sure.
Hillary L. McBride. The other one's Hillary Leanna McBride. And I just
Fine. We'll
don't
link them.
remember yet. One of those two. You'll find me.
Perfect.
If you're
Yeah.
looking, you'll find me. And then
Google
books
works quite
wherever,
well.
yeah, Google works great. Books wherever books are sold, podcasts where you find your podcasts, that sort of thing.
Yeah. Okay. Thank you so much.
Mm,
I'm just going to stop now because I never know how to stop.
okay.
Bye, everybody.